I hope you had a good day. Let me start by introducing myself. My name is Amal Assis. I'm the Student Services Officer at the Faculty of Health Sciences at the American University of Beirut. So we are here today to try to give you more information that would be beneficial, hopefully, and to introduce you to different majors that are not traditional, that maybe you are not exposed to. Let me just start by introducing our experts, our faculty members, who are all teachers at the Faculty of Health Sciences. So first, Mr. Al-Khatib, who is the advisor and a professor at the Medical Laboratory Science Program. Good evening, Roland.
Hello, how are you, Ms. Assis?
Hi, Roland. So Dr. Jumana Nasser is a professor at the Faculty of Health Sciences in the Environmental Health Program.
Hello, Amal. Hello, everyone.
Dr. Mayada Kanj is the advisor and a professor at the Health Communication Program. Good evening. And last but not least, Dr. Salam Hannoun, who is the coordinator and a faculty member at the Medical Imaging Sciences Program.
Hello, hello.
So welcome all to this webinar. We have a short program. We will start with a general introduction. Then we will move by giving you information about the 4 undergraduate programs at the faculty that are related to public health and to health professions. Then we will be opening the floor for your Q&A, for your questions. During the presentations, we'll be asking few questions and asking you to interact with us. So Maya, if you can please start with the presentation.
Yes, sure.
Yeah. So why did we choose the title Public Health in Times of Crisis? Most of you as teenagers, you are exposed to many challenges in your life, and especially in the last 2 years. Every one of us passed through these challenges. This is the time in these 2 years, public health bloomed a little bit more than usual because people were more able to identify with these crises, unfortunately. But this is why we are trying to explain to you what is the importance of the public health professional in this period. Where do they have an impact? What role can they play? So you are all used to popular majors that are known by the population in general, like biology, like computer science, engineering, business. We are here to tell you a different story, to shed the light on majors that are not known as much as they deserve to be known and as much as they are really in demand. So we do have problems in the number of workforce that have these expertise. So we have very few people who are actually graduating from these majors, and we have a large demand in the market. And this is why we are here to tell you a little bit more about them. So at the Faculty of Health Sciences at the American University of Beirut, we have 4 majors: Environmental Health, Medical Laboratory Sciences, Medical Imaging Sciences, and Health Communication. You might be aware, but we will emphasize the fact that this is an American University of Beirut, so this is an American system. In the American system, this is quite different from the French system. You have option to take courses in your major as well as elective courses. So it's more of a flexible program. You have structured schedule, you have courses to take, but they are a diverse group of courses that fall under major requirement or major related or electives. The regular period for completion of a degree is usually 3 years. So you can complete your degree in 3 years. So what is common among the 4 undergraduate programs? You can finish in 3 years, like any other major at AUB, except very few majors like engineering and architecture, You can follow the regular track, or you can decide to pursue the pre-medical track in order to join medicine later. And as I mentioned at the beginning, 1/3 of the courses that are taken are general education courses, which means that they are courses that could be from categories such as arts, humanities, social sciences. So they actually expose you to a different list of courses other than your major courses. And this allows you to really have a well-rounded personality, to be exposed to subjects that are other than the science or the major subject that you are taking. So what is different in our majors? The main difference between our majors and other majors at AUB is that this is in the faculty, we graduate student with a profession in hand, which means that you can directly get employed and find a job. Why? Because there is a component in the majors that is a hands-on experience. This is the practical training or the practicum, the internship. In the environmental health major and in the health communication major, which are public health related, in these two majors, we take an internship. It's a training, yani stage, at a specific institution for a period of 1 month, where you will be exposed to different projects. And this is an introduction to the job market, where you can actually get employed. You might be employed in the training side. For the medical laboratory sciences and the medical imaging sciences, which fall under the umbrella of health professions, in these two majors, you have clinical training. So you actually take your training in the hospital in UBMC, and the training is quite long. It varies between 11 months and 2 years for the medical imaging sciences. So this is what distinguishes us. This is what makes it different, because actually you are getting a degree and you have a profession along with the degree. So now that I gave you a briefing about the 4 different programs, we'll start by giving the floor to our faculty members. So we'll start with the environmental health program with Dr. Humayns.
Hello, everyone. Basically, as Ms. Assis mentioned, while choosing a major, it's very important to start thinking outside the box, to think of non-traditional majors that may open the door wide to a very big range of job opportunities. And environmental health is one of those majors. It's a 3 years program that includes courses and hands-on experience, like lab work, field work, and an internship. So basically, the major courses provide you with fundamental knowledge of environmental health, with emphasis on evaluation, on prevention, and control of the major environmental problems. Those problems that you always hear about over the media, that you read about locally, regionally, and internationally. So in the program, you will learn about air pollution, about water treatment, wastewater treatment and reuse, food safety, occupational health, and how to make your workplace a safe place, on toxicology and the risk analysis, the toxic agents in the environment and how do they affect you, the management of solid waste, how to manage the solid waste, be it municipal, be it hazardous, infectious, and this is a real problem in many developing countries and in Lebanon as well. This is in addition to many other interesting courses like environmental economics, environmental ethics, instrumentation and sampling, and others. In the internship, which is a mandatory internship, the internship aims at supplementing your theoretical knowledge with real life experience by spending many weeks in pre-approved sites like NGOs, international organizations, engineering companies, petroleum administrations, and others. The big question is, where do I work when I graduate, or what do I do when I graduate, knowing that our program can have a regular track and a pre-med track. At the end of the regular track, this means after 3 years, you will graduate with a BS in environmental health. You can continue graduate studies or join the workforce. If you go for the pre-med track, after 3 years, you will have a degree or a BS in environmental health. You can join the workforce. You can go for graduate studies, PhD or MSs or master's degrees, and also you can sit for the MCAT exam. So basically, we have a percentage of our graduates that continue graduate studies. Some join the medical school and some join the workforce. And you can work in international organizations. You find our graduates in UN agencies. They can work in UNDP, UNEP, WHO, and others. You can work in ministries, Ministry of Environment, Ministry of Energy and Water, Ministry of Public Health, Ministry of Agriculture. You can work in non-governmental organizations. You can work in hospitals, knowing that now big hospitals are seeking accreditation. And to be accredited, they need to have environmental specialists to deal with the water quality of the patients, with their wastewater, with their air pollutants, with their solid waste, infectious waste. You can work in big industries, knowing that industries now are seeking certifications like ISO and others to be able to compete in the market, and thus they need environmental specialists. You can work in engineering firms doing EIAs, which are environmental impact assessments. So you know that any project, before being given the permission to start the construction, highway, school, university, anything, they need to undergo environmental impact assessments to check what are the negative impacts of that project on the environment, and accordingly, you get the permit to start constructing it, or you need to modify before getting the permit. So this is something very important. They work in petroleum administrations, in petroleum companies, and we have many working there. And of course, in research centers, medical schools, and academia and others. Thank you.
Thank you, Joanna. So now we move to our second program, the Bachelor of Arts in Health Communication. Dr. Tanj.
Yes, so this is actually the only BA in the faculty. We offer a Bachelor of Arts, unlike a BS, which the other programs offer. Now, the BA in Health Communication, it's the first program in the Arab world. It is an accredited program. And when you graduate as public health professionals as well as health communication experts. So health communication, in the program, you will learn, actually, it is the art and science of communication to promote health. And I think the easiest way to describe health communication is if you think of the COVID epidemic, if you think of the cholera more recently. So all the messages that you saw on social media, all the messages you saw on TV, that you saw on billboards, on TV, this is really what health communication is all about. So it is basically a major that is appropriate for anybody who is interested in health, as well as working with the social and digital media. Okay, so now because in the program you take courses in public health as well as courses in media studies, so that offers you a wide range of options and diverse options for employment. You can work at international organizations, and these are some examples here, like UNICEF, WHO. You can work at government organizations, ministries, civil society organizations that work on social and health issues and environmental causes as well, advertising and marketing companies with a focus on health, hospitals. More recently, all hospitals to be accredited require that patient education is a department in their healthcare facility. So health communication graduates can work also in patient education departments, as well, of course, as working in academia and academic settings.
Thank you.
Thank you.
We will take a second to ask you two questions. So it is just related to your school. Maya, would you launch it? So
Yes.
the first question.
Okay, we'll start with the first two questions. You just need to select one answer from for each question. So the first question is, you are a high school student or a parent or school counselor, university student, or none of the above, You need just to select one answer. And in which grade you are at school. You're at grade 9 or brevet, grade 10 seconde, grade 11 bac 1, or grade 12 terminal.
Maya, we have
none of the above.
someone who is none of the above.
Yeah. Please make sure all to answer the questions.
So we should reach 120, which is the number of participants.
Yeah, it's actually 117 or 118, because people are getting out and getting in because of internet
Well,
issues.
interesting. We have a good number who are in grade 12. So like more than 64% of the attendees are in grade 12. So you are actually applying this year to universities. And you have a couple of days to apply. So this is interesting, as this will help us direct your questions according to the audience.
Okay, people are still answering. We'll wait for a few seconds before we stop the poll. Okay, we can stop now. Okay. All right, poll is stopped. Now we will have another question for you. And we need this time to write down or type the answer. Please indicate your school name, from which school you are. And for those who are attending from a university, also please type in the name. All right, we have 45 people. We need more to type the answer. From which school you are?
Great, we're getting to the majority.
That's great. We have 83 responses till now. We still need more.
70%.
More and more. Few seconds left before we stop the poll. Hurry up. We still have 20 answers needed. Okay, that's great. Few more. في ناس ما بدها تقلنا من ايام مدرسه ما حابين يخبرونا بدنا نعرف حابين نعرف ما رح نشكيكم اذا حضرتوا او لا ما تعتلوها. So we still need 10 responses, but we're fine. We're fine.
I think we're
okay,
fine.
someone is laughing. Okay. All right, we'll
So
stop the
thank
poll.
you.
Thank you.
Thank you, Maya. So thank you all. This is actually very informative. We really need to know some information about the participant to continue our communication with you. So now we will continue the presentation. Maya, please, if you can move now to the medical laboratory sciences.
Yes.
So 2 more majors, and then we open the floor for questions.
Let me just stop sharing and I will share again. All right, so now we'll go for the medical laboratory sciences.
Actually, can we start please with the division of health professions?
With the division, yes, sure.
Thank you very much.
It's one slide before. Okay.
Yes.
Thank you.
Thank you very much.
Nisrullah?
Yeah, thank you. Hello, everyone. So the Division of Health Professions hosts the Medical Lab Sciences Program and the Medical Imaging Sciences Program. These are 2 interdisciplinary programs offered at the Faculty of Health Sciences jointly with the Faculty of Medicine. Our objective is to graduate highly competent and committed healthcare professionals to serve and improve the health needs of individuals and communities as well. Medical laboratory scientists are highly skilled professionals who conduct up-to-date lab tests that could assist physicians in the diagnosis and in the treatment of diseases. In addition, the results of those lab tests are crucial to follow up patients following treatment. As such, they are part of a healthcare team responsible for the health and well-being of people. Therefore, our graduates should acquire theoretical knowledge as well as practical skills in the various disciplines of the specialty. During their second year, our students will start with their major courses in the various areas of laboratory medicine. And during their senior year, as mentioned by Ms. Assis, they follow a program of intensive training in the hospital lab, where they rotate in the different sections of the lab at UBMC and are exposed to the various disciplines of the specialty. Now, let us explore the various areas of laboratory medicine, including, as you can see, bacteriology, cytogenetics, hematology, etc., highlighting the importance of lab tests in confirming a diagnosis. Suppose a patient is manifesting high-grade fever with severe headache, nausea, and vomiting, and these symptoms could be suggestive of an upper respiratory infection, of meningitis, and both can be of bacterial or viral origin. Different lab samples should be taken from the patient and sent to different areas of the lab to confirm the diagnosis. So we cannot confirm the diagnosis based on the signs and symptoms manifested by the patient. And I'm going to list few samples that we will be taking from the patients and will be sending to different areas of the lab. We will send blood to the hematology section to perform a test known as CBC. CBC is the complete blood count. This will show an increased white blood cell count, and this happens whenever you have an infection. In addition to that, we are also interested in identifying a particular type of white blood cell that could be increased and that could be suggestive of a bacterial or a viral infection. Those cells here that you can see in here, these are neutrophils. If they are increased, this would favor the diagnosis of a bacterial infection. Other cells, known as lymphocytes, will favor a viral infection. And this is very important to identify early on because, you know, viral infections are self-limited and we do not treat them with antibiotics. Based on the signs and symptoms, we need also to take a throat culture and to send it to the bacteriology lab in order to check for the growth of bacteria. If we're going to see bacteria on the plates, we need to do a sensitivity test. This is a test that would identify the antibiotic of choice that should be given to the patient to treat that particular infection. So this is why we're mentioning and emphasizing the importance of the results to make a diagnosis and to monitor patients and to decide on the proper treatment to follow. Various samples are sent to the molecular diagnostics lab and obviously to do a PCR in order to rule out viral infections. And you're familiar with many viral infections. I'm going to list few. COVID-19, you're familiar with it. Influenza A virus. Now, I think you're hearing about H1N1, H3N2. These are subtypes of influenza A. Meningitis. Early meningitis symptoms may be very similar to the symptoms of flu. And this is why we really need to detect if this is meningitis or a viral infection or a bacterial infection, etc. If our patient is dehydrated, we have to send blood to the clinical chemistry lab to check for electrolytes, sodium, potassium, etc. Because in that case, we need to give IV fluids as needed. If a patient has diarrhea, you know, a stool sample should be sent to the bacterial lab, among others, to check for a number of organisms, including, and I think you're going to guess, Vibrio cholera, that has currently re-emerged in certain areas of the country. If you're going to do a blood transfusion, you need to check for the blood group antigens in order to avoid transfusion reactions. In the serology lab, we can check for IgG antibodies in order to assess our immune status after an infection or following vaccination. And last but not least, quality control is emphasized across the disciplines to ensure both precision and accuracy of lab results. Following graduation, about 26% of our graduates apply to the School of Medicine because they believe that this program equips them with a very solid background to succeed in the field of medicine. And around 24% pursue a Master of Science or a PhD in various disciplines of laboratory medicine or basic sciences, or even a Master in Public Health. Around 45% are employed after graduation, and we are actually distinguished by immediate employability. Our graduates might work as lab scientists in hospitals or in private labs, as medical representatives or managers in pharmaceutical or medical equipment companies, as researchers in universities, or as healthcare workers in governmental or international organizations. Thank you very much.
Thank you, Rola. So now we move to the last major, the Medical Imaging Science Program, Dr. Hannoun.
Hello, everyone. So I'm Dr. Salim Hannoun. I'm the coordinator of the Medical Imaging Sciences Program. I'm going to talk to you a little bit about our program. So first of all, what is medical imaging sciences? Well, medical imaging sciences is a healthcare profession that is concerned with imaging the body parts and the diagnosis of various disorders and diseases. So instead of people going back in time, people dissecting the skin to find out whether this patient has some sort of a cancer or some sort of anomaly, all what you can do now is just take a picture or take a scan of this patient, and you will know what he has. So he or she has. So this is done through the study of the organ structure, or what we call the anatomy, or even we can push it a little bit further. We can go and study the organ function, which means the physiology. So following the diagnosis of a certain disease, this discipline will allow you to assess the response of treatments, let's say, given to the patient, all while caring for them and providing them with the most pleasant experience in the department. So during the 3 years of study that you will spend with us, you will acquire both theoretical knowledge and practical skills in various imaging modalities. You will learn how to operate the equipment while maintaining safety procedures as well, for yourself as well as for others. So medical imaging technology is a rapidly advancing profession, and the radiographers are expected to have a high level of knowledge and skills to operate and control the imaging technologies, whether they are digital radiography, going to computed tomography or CT, or MRI, if you know it, magnetic resonance imaging, or even ultrasound. So radiographers will play a pivotal role in selecting and implementing the most appropriate imaging examination protocols, but they are also bound to act in a professionally responsible and ethical manner, and they have to exhibit a high level of communication skills. So upon graduation, most of our graduates will continue their formal education in advanced programs. Around 40% will pursue master degrees of public health. Some go do master's degrees in basic science. Others also continue in biomedical engineering, let's say. After their master's degrees, they will enter an international PhD program to continue with research in academia or in industry. Some of our students, some of our students who pursue the pre-med track will go on and apply to medical schools, and the remaining 40% will occupy radiographer positions in hospitals or healthcare centers. Some will go into teaching following a few years of experience in the field, or work as medical representatives in pharmaceutical and medical equipment companies. So if you are interested in medical imaging technology and you have a caring personality, then MIS or medical imaging sciences could be a good fit for you. Don't hesitate to go onto our website to learn more about the field, and feel free to contact us at any time for additional information. Thank you.
Thank you, Dr. Hannoun. So I encourage you now to start writing the questions in the chat. I will start by answering few of them or directing the questions to the experts. Just before beginning, some of the questions are related to having this session, since it is recorded. Maya, don't launch them, please. Wait a bit.
Okay.
Okay, just let me point out a few things. First, the session is recorded, as you see. It's going to be posted on our YouTube channels. And then once we post it on the YouTube channel, we will share with you the link. So I hope that you have all specified your email correctly when registering, so that we are able to send you the link. Second, there were some questions related to how to apply and when to apply. So if you notice today, we have limited our discussion to the core undergraduate programs at the Faculty of Health Sciences. You might be aware that the AUB Office of Admissions holds sessions to different high schools, whether online or in person. We also have all the information on the AUB Office of Admissions website. So if you just log in there, you can see that you have the deadline to apply for those of you who are now in grade 12. The deadline to apply is December 20th. And this is the main reason why we are holding the session today, so that you have the chance to listen to different majors that are available. How are you going to apply? It's an online application. So once you log into the AUB Office of Admissions website, you can see directly where you can select the online application for the sophomore students, and this is where you can directly fill it. It's very easy to fill. You can start by filling it, and then later on you can provide the documents that are needed to the university, as long as you submit that online application. Just to give you a briefing about the requirements for admission. So you might be aware of that, but let me just give you a very brief information. To be able to apply to the university, you have two major components that are necessary. The school grades of grade 10 and grade 11 are taken into consideration. You are actually applying while you are in grade 12. And always the deadline is the December of the year you are pursuing your grade 12. For the grades of your school, the grades are usually standardized, which means that you are compared to your classmates and to your school in general. So we cannot compare French systems with English systems. We only compare English systems together, and we also compare you to all the graduates from that specific school that you are enrolled in. So this gives you an advantage because you are actually compared to your peers and to the same school system and average of the same school. So this is 50% of the, at the end, there is a score that needs to be, that you will be that is taken into consideration for admission. We refer to it as admission score. 50% is on the school grade and 50% is on the SAT. So I'm sure that all of you are aware of SAT. You can apply before taking the SAT. Madam just asked this in the chat. So you can apply and then you submit all the missing documents later on, one of which is the SAT. So the SAT, there's, as I mentioned, 50% on the SAT. One component of the SAT is math. The other component is English. And the English part will specify which level of English you will be, if you are accepted, and which level of English you will pursue your studies. So English is also a requirement. Okay, so the SAT results, so I have many questions in the chat about the SAT results. Let me start by reminding you that deadline is December 20. You should have taken the SAT a couple of days ago. If you haven't done that, then you will need to sit for the March SAT. Till now, the university has not decided whether they will take the March SAT or not. The policy was that only the December SAT will be taken. Nonetheless, there is nothing that prevents you from sitting for the March SAT and try your luck to see if the university will relook into this policy. Okay, let me read the questions in the chat. So definitely the SAT results will not be out before a month, but you can submit the application now. This is an answer to Tanya. Yes, so just submit your application, and once the SAT results are out, you can add them to your application. You can apply before taking the SAT, as I mentioned. Please do log into the AUB Office of Admissions website because we have all the information there. I just give you a briefing about it, but I want to also inform you that every Thursday at 4, so next Thursday at 4, the Office of Admissions holds a webinar that can explain, where they will explain all the information related to admission, to financial aid, and to scholarship. So if you are really planning to apply to the American University of Beirut, and for hopefully to our majors, please do attend that session. So it's next Thursday. They have a session on December 15 at 4. It's online, so you just log into their webinar. Okay. There are many questions about the SAT, so let me just go over them, Maya, before we ask our questions.
Yes, sure. We have Hussein who asked about the requirements for scholarship. What are the qualifications to get the scholarship?
I will talk about the scholarship later on. I'm going to focus now on the questions related to the SAT. So recommendation letters, if we are talking about undergraduate students, because we have some university students in the among the participants, for the recommendation letters, they are not required for undergraduate applicants, but they are required at the graduate level. So I have a few questions related to the SAT score, whether it is 900 and whether this secures acceptance. Now, this is, if you recall what I mentioned, there is 50% of the weight on the school grades and 50% on the SAT. So it's a combination of both. If you are a top student in your class, so if you are among the top 10% and you got an average score in SAT like 900, you might be accepted, but then again, it depends on the pool of applicants that are applying to the major. So the SAT by itself is not enough. We need to look at your profile, school grades and SAT. If you are not doing well in your school grades, if you are an average student and you are getting average scores, then the low SAT is not enough. It is recommended that you repeat it because we do take, the Office of Admissions takes the highest scores in SAT. So they always take the highest score. So if you got the highest score in the first SAT that you sat for, you took a high grade in math, a low grade in English, and vice versa. And second, we take the highest in each one. Okay, so it's a combination. I cannot tell you you need to get 1200. This is not fair as a or accurate as an answer. It is a combination of school grades and SAT. Okay, so 900 is not that good. You need to get a higher score. It's very average. Okay. What is the EEE exam? So Muhammad, the EEE is only, this is English entrance exam. This is only required if you don't get a good score in the SAT verbal. So as I mentioned previously, in the SAT, there is component related to English. If you get a good score there, there is no need to take the EEE. SAT is still mandatory. So replying to Mahdi, the March SAT, currently the Office of Admissions are not going to take the SAT March into consideration. But again, if you have missed the December SAT, or if you got a low SAT score, it is highly recommended that you repeat it. Either you have two options. Either the university might rethink of or reconsider their decision to take the March SAT, or you could benefit from it to apply for the spring term, if not the fourth one. Okay, did I miss anything on SAT, Maya? I'm not sure. What is
there was a question about the remedials, English remedials, about the SAT score that exempt the student from English remedials.
Okay, so this is too detailed. You can check it on the Office of Admissions website. It is a certain score, like if I recall well, you need to get a certain score in three subjects within the English. So we have verbal, writing, and the third one. If you get 4 in each, you will get placed in a specific English level. I think this is too early for you to think about. I would rather focus on SAT, on the overall grade, because English is a minor component that you can, there is always an alternative and a solution to the English, because you can take the EEE or the TOEFL. There are alternatives, but there is no alternative for SAT.
We have a question also, what is the EEE exam? Is it an alternative to SAT, or SAT, is it still mandatory?
I answered this. This one I answered.
So no more questions?
But there is a question from Mustafa Baroudi, if you are alumni from certified programs. This is not clear. The link is that of the Office of Admissions, so it is directly, so I didn't highlight the December SAT. I'm saying that you can check the application on the Office of Admissions. For the SAT, you need to log into the College Board. Also, it is on the Office of Admission website. I'm going to take a break for a minute. We're going to ask a few questions and then we continue. Maya, can you please launch the poll?
Okay, so the poll is open. First question is, how did you hear about this webinar? Through your college advisor or high school or student counselor, a friend? You saw the ad on Facebook or on Instagram, or you visited our website and knew about our event? And the second question is, how did you find the session informative? Yes or no, to a great extent, to some extent, or not at all? So please, if you can choose one answer for each question. Okay, we want more responses. More. We're waiting for your answers. We have 20 more people. We're waiting for your answer. Please, if you can hurry up a bit. Okay. Okay,
Okay.
done. We still have one Amal question. We're gonna launch it now.
Yes. So
we want to know in which program you are mostly interested, as you heard and saw the presentation, and you had some information about our undergraduate programs. So please, we want you to specify or pick one program only that you are mostly interested in. There is a competition now. Everyone is answering. Yalla, vote for the program. I want to know which program is more interesting for you. Okay. We still have a low rate of participation. We want you to participate and answer this question.
okay, someone is asking whether he can reply to the previous questions. Once we launch the poll and ask questions, we cannot go back. So unfortunately, we can't relaunch them.
We still have like 40 people who didn't answer, or maybe 30 people. So please, for those who did not select one answer yet, please, we need you to answer as soon as possible. Okay, few more seconds.
So Maya, in the chat, someone is asking they are not being able to click. I'm not sure what's the issue. It's okay.
It's fine. It's fine. Okay, thank you.
Okay, great. So now, yeah, number one is medical lab, and the second is medical imaging, health communication, and then environmental health. Okay, so I'm encouraging you to ask your question in the chat related to the majors themselves. In the meantime, there are two questions about scholarships. So I'm going to give you a brief idea about the scholarship and the financial aid at AUB. Again, we want to refer you to the office admissions webinar that's going to be held next Thursday for full information. In brief, okay, I am next Zoom meeting. Who is referred to as iPhone? So the chat, someone is writing in the chat, and this is not clear. Next Zoom meeting, if it is the webinar of the admissions office, you need to log into the Office of Admissions website, and this is where you can find the actual link. Going back to the financial aid and the scholarship. So AUB has been putting a lot of efforts in the last couple of years in view of the financial situation and the difficulties people are going in to actually increase the number of financial aid offered to students. The university actually has increased the percent granting to more than 70%, a maximum of 70% for students. Of course, there is an assessment of the financial situation. You need to make sure to submit your application online for the financial aid alongside with the admission application. There is also a deadline for the financial aid application. You need to provide all documentation there so that they can study the case and assess the financial need. When we discuss financial aid, the financial aid received or granted to students is purely based on needs. So there is an assessment of the financial situation of the family in whole, and then they decide on the percent to be granted. This is quite different from the scholarship. When we say scholarship, then this is based on merit. This is based on academic performance and academic excellence. There are many scholarships available. Some of them are listed on the, so also you need to check the financial aid website. You have a list of scholarships. If you are in a public school, you know that there is the merit scholarship that's based on the highest score in the Lebanese BAC. So if you get the highest score in the Lebanese official exams, This is when automatically you get a scholarship to study at the university of your choice. There are other scholarships that are specific to EUB. You have the USAID scholarship that's also offered. So you have many opportunities. You really need to dig into these opportunities. So if you are interested in getting a financial support, you can submit to the USAID scholarship. USAID is based not only on financial status, it is a combination on financial status and on your overall profile in terms of leadership skills, communication skills. So answering the questions, Angelina, we will be posting this webinar on YouTube and we will share with you the link as long as you have specified to us when you register to the session with email account. Okay. Someone asked if they are studying, so this is Tami, I think. If not Zena, if you're studying biology at standard level in IB, for biology we require Sorola standard level. This is not the high level. This is a subsidiary.
Yes.
I think they need to take 2 levels of biology.
Usually we check these after they apply and they enroll. So we'll have to check their levels of biology, chemistry, and physics, depending on the major they're joining. And they might have to take few remedial courses. So at this point, it could be for biology a high level, I assume.
Okay. So this is
They have to check with the biology department anyway.
It's also listed on the Office of Admissions website. We can check this later on. Zaina, if you want to send us an email, we can reply. Mr. Mustafa Baroudi, so if you are alumni from certified programs that pass English language skills, so this is all depending on, SAT is different from English. SAT has a component in English, but it has another component in math. It is a mandatory requirement for admission. So the acceptance is based on the score that the student gets in SAT. You can get 800 over math and get 400 over English. So the question whether it affects acceptance or not in terms of English, it's not the English itself, it's the overall score. So some students might be excellent in math, but not good in English. And this is when their score could be high. The SAT score will allow them to enter, to get accepted into the majors of their choice, but it is not related to English itself, if I made myself clear. So let me ask a few other questions in the start. So there's a questions about the environmental health program. So this question is from Gina. What are the topics that I will be studying if I'm joining the environmental health program?
Basically, when you join the environmental health program, you will be studying a wide range of topics. All of these topics that you always hear about, and they're problematic in many parts of the world. So you study water quality, water treatment, how to know whether the water is of good quality, if not, how to treat it, how to treat wastewater to make it reusable, instead of just dumping it in the water bodies as raw wastewater. We study air pollution, indoor air pollution and outdoor air pollution. What are the pollutants? How do we categorize them? What are their health impacts? We study solid waste management, how to manage the solid waste, be it domestic, municipal, be it hazardous, toxic, be it infectious waste from hospitals. How do we manage that waste? And this is a major problem in many parts of the world. We have courses on environmental impact assessment, as I said. So anytime we want to construct a project, we need to check the negative impacts on the environment of that project. And accordingly, we will get the permit to start construction as an engineering company, yes or no. So basically, you do environmental impact assessments, you do audits to already existing locations. We study environmental economics. You know that environment also relates to economies of countries. So it affects the economical system. The economical system is affected by the state of the environment. So basically, there's a very wide range of topics. You study toxicology and risk analysis. What are the toxic agents in the environment? What are the risks to human health, to ecosystem, and to different components of the environment? You study occupational health, how to make sure that the working environment is a safe place. So you look into safety, and here under this entity, our graduates, they work in petroleum administrations and petroleum companies in their safety departments. So this is very broad.
So that's basically the undergraduate degree opens the door to a variety of options that they can pursue at a higher level. So let's say if I'm interested in environmental policy, so like all other persons in this population, we have environmental health problems, and we have very few solutions. So let's say I'm interested in putting policies or making sure that policies are implemented. This is where you actually do a graduate degree that maybe in environmental policy and planning. And so the idea is that we can specialize in a specific field of your interest. When you talk about environmental health at the undergraduate level, it's really very broad. Like when you say biology, it's very broad. You have many specializations, as Dr. Nasser was mentioning. So you could be interested in water quality. ليه عنا أزمة مي بلبنان؟ موضوع. So getting the environmental health itself as an undergraduate degree, it just opens up the horizon for another field and another set of graduate studies that you can pursue. You might decide to specialize in water quality. What is the problem? Why do I have a water problem in Lebanon ونحن عندنا كل شيء في rivers جوا? So how do you actually make the change? The same applies to wastewater management. ليش في عندنا مشكلة بلبنان? So we do need people in these fields. We need experts. This is a major thing that we are lacking. We don't have the specialists عم بيشتغلوا the right positions. So
may I, Amal, one thing, please?
تفضلي.
Basically,
So هيدا أنا مش expert. أنا بس عم بعطي my perspective.
So basically, one important thing to add is that our graduates can work from the micro level in the lab to the macro level in developing strategies, in developing policies, and our graduates and faculty members do develop strategies at the level of the country when it comes to environmental problems. And again, you mentioned the graduate studies. Of course, in an American system, if they have a BS in environmental health, they can join any master's degree, but we have masters in environmental science at AUB with its different tracks. So you can join environmental health as a track in the master's, environmental technology, ecosystem management, and environmental policy. So we do have environmental science also at the graduate level.
You can also go to biomedical engineering. So if you are interested in that aspect, you have so many options. Even engineering now, you are all exposed to engineering as a major. You think of engineering as a career with prospects. It's actually currently with the changes in the academia, the changes in the applications, an engineer cannot work on himself, a civil engineer. Civil engineering is mechanical engineer, environmental engineer. Yes, because in the new system, يكون في عندكم approval for the project, you need to have the environmental component in it. So that's why you need to really, this is what Dr. Nasser mentioned at the beginning, think out of the box. It is not the standard majors that you know of, like engineering. It is environmental engineering or biomedical engineering. There are many specializations that you can think of. And so make your own change, see what can you excel in, what is really interesting, and join it. There is a question in the chat about the minor in FHS. So Zaina is asking about the minor. the minor, I'm not sure if everyone is aware of this. So the minor is the fact that you take 15 credits in a certain topic. So again, I'm going to take the example of environmental policy. Let's say you are pursuing environmental health as a degree, but you want also to be exposed to another major like political studies and public administration. So you want to join public administration with environmental health so that later on, if you work in in the ministry, you know the public administration part of it. So as an American institution, in all the majors, whatever major you are pursuing, whether it's environmental health, medical lab, or medical imaging or health, you can do this minor, which means that out of the credits that are required for graduation, you select 15 credits. So this is like 5 courses in a specific topic. It could be chemistry, it could be business, it could be public administration, or maybe psychology. And this will help you get exposed more to that field so that maybe you can pursue your studies in the specialization you are interested in, like I mentioned, biomedical engineering. So you can select courses in the minor that will help you get into your goal of the graduate studies in biomedical engineering.
Amal,
So,
we
yes.
have a hand raised from Ali
Ali.
Saleh. He would
Yes.
like to ask a question.
تفضل علي.
Hello, it's Ali from Bayan High School in Harat. You hearing me?
Hi, Ali.
Yes,
Yes.
تفضل
Yes,
علي.
you can.
Yes. Thank you for this conference and everything is clear. I have a small question about the financial aid. Sorry for the bad quality of my voice because I'm having flu.
No problem.
We need to do tests, Ali,
Yes,
to make the
PCR.
diagnosis. Send
Yes.
us the sample.
Okay, so financial aid. تفضل علي.
Yes, about financial aid. Can we be taking a student loan, okay? So if the financial aid does not cover all what we should pay, can we be taking a loan as what other universities present? And after graduation, we'll be just getting back and
Yes, I
paying
got the
the
point, Ali, but I don't want to answer this. I'm not the person in charge of the Office of Admissions or the Office of Financial Aid. That's why I prefer if you direct your question to them. As I mentioned earlier, there is a webinar next Thursday because this is very specific as a question. At one point in
course.
time, they used to be giving loans, but I'm not sure if this is an option now.
With the current
because they are
financial
giving-
crisis, yeah.
So I'm not sure if this is an option. We don't want to give inaccurate information. So please just, you can call them or it's preferable that you attend their webinar.
Okay,
Okay.
but when is the date of the winner?
Next Thursday, December 15 at 4. It's an
Okay.
online session. You can just log into the Office of Admissions website and you can find there the link to their webinars.
Great, thank you.
Okay, so welcome, Ali. We have typed in, Maya has kindly typed in the link, so you can see
Yes.
it in the chat.
For the admissions.
If I want to major in biology, I have excellent grades, but low grades in social studies. It doesn't matter because we just took them at the average. So are you doing IB or you are doing a regular baccalaureate, bac Libani or bac Français? So Tammy, this is just if you are following the IB, you know that for the IB we look a regular one, then there is no problem. We just look at the average of that of the grade, so grade 10 and grade 11, not grade 12, and you are compared to your school, to your high school, not to any other school. So if you are a top student in your class, this is fine. It doesn't matter if you're not doing well in other subjects. It's the average that matters, not these specific subjects. So, okay, great. I have a question from Aya. What are the currently in Lebanon? What are the career options for radiographer? So, is there a demand for this field specifically?
Yes, so for radiographers, especially with the new pandemics like COVID-19, you have all seen that radiographers, as nurses, as medical doctors, they have been at the forefront of the war, if we can say, against the pandemic. So there is a huge demand now for this profession as radiographers. As I said, you will directly be taken as a radiographer in hospitals and private centers, private imaging centers. We can always try to work also in the technology field, work in the with the producing factories of the companies, of the medical imaging companies and machines. So, yep.
Okay, Dr. Hanoun, thank you. So we have a question from Christelle about whether which program actually prepares us better for the MCAT. Rula, do you mind answering this?
Yes, sure. So actually, Christelle, you know that any student can apply to the School of Medicine. What you need is first to get a bachelor degree. And within the major, so when you complete the requirements for the major, you're asked to complete a number of courses that we call the pre-medical courses. And these are required by all students following the pre-medical track. These include courses in biology, chemistry, physics, humanities, social sciences, and English. In addition to that, pre-med students should sit for the MCAT. This is the exam required for all pre-med students. And in the end, the admission will be based on the average of the pre-medical courses, on the academic achievement in the undergraduate years. And here they look at the cumulative average of all courses, the MCAT scores, and the results of an interview.
Okay. Allow me, Rula, just to note one thing. So, as you mentioned, you can pursue pre-medical platform this in terms of preparation for the MCAT itself. As mentioned, it is very competitive. So you need to have really very high grades to have a better chance of getting into medical school. From that perspective, you would think that getting into biology would prepare you better. This is not true because in biology, you have a very large, you have large classes. So you have like more than 400 students in the same class. This is what makes us as FHS different as a faculty because we have small classes. When you are interacting with your course instructor, when you have 30 students in a class, you'll be able to increase your focus in the class. You will be able to interact with the course instructor, and this indirectly will affect the performance. This is one thing that you need to think about, whether the major will allow you to really interact, to be at ease, not to have a very high competition like the case in the regular majors or the majors that are very popular. Another aspect is that you need to think of a backup plan. You might be considering medicine now, and later on you might change your mind and think that maybe I don't want to pursue medicine. And this is when it's very important to have an actual profession in your hand.
Profession in hand, yes.
That's why this is also what is different at FHS. Once you graduate with a medical lab degree or a medical imaging degree, environmental health, you can directly find jobs because there are majors in high demand. It's quite different from biology, chemistry, and physics, basic sciences that are really very broad, and their career opportunities are limited, maybe to teaching, to
yes,
I don't know, working in institutions, but they're really quite limited because of the broad aspect of the major. Someone was asking in the chat about computer engineering and computer science as a faculty of health sciences. This is not under our jurisdiction. Of course, there are majors at AUB. AUB offers computer science and computer engineering, and that's why I will direct the questions to the webinar next week. But again, rethink your choice. Are you doing any shadowings? AB Faiz is asking this. We have actually started this
Exercise.
we did it at the faculty for a couple of students through a draw. We selected around 6 students. Maya, they did the shadowing with us.
Yes.
It was very beneficial for the students. It's very important that the students be really knowledgeable about the major that they were interested in. They cannot be doing the shadowing in the same day for 4 majors at the Faculty of Health Sciences. It's better. They found it overwhelming because it's a lot. So that's why we may do this if there is a very specific interest in a specific major. So we would rather first, and everyone has to really, all the participants are encouraged to do the exercise. You need to read. I know that this generation watch our videos, look at our social media platforms, listen to our students giving their testimonials. So try to read a little bit to know more about what the major is about. And then you can have very specific questions. Of course, you are all welcome to come to visit us at the faculty and ask questions to our faculty members to help you, to guide you, get
and decide on the major of choice. Yeah,
exactly. Maya, are there any questions that I missed?
So far, no. Someone asked about the computer engineering and computer science. No, unfortunately, we don't have this major at the faculty.
Yeah, she answered.
I answered that one.
Yeah.
Okay.
And that's it.
So I have one more question. So I think I missed this question. It's about health communication. So can you explain a little bit more, give me an example to understand exactly what health communication people do besides the campaigns? So what are the skills needed to join this team?
Yes, so if you are if you join the health communication program, you learn, you take courses, as I mentioned, in media studies. You take also courses in public health. In media studies, you learn about, how to use digital media, how to use different social media platforms to disseminate health messages. In public health, you learn about how to plan, about health communication theory. You learn about how to assess needs of specific groups in a certain community, for example, mothers, children, young people, youth, adolescents, assess their health needs and accordingly prepare health messages and send those messages through different communication channels, which can be either social media, like mobile phones or YouTubes or others, or it can be more traditional platforms like a TV, billboards, posters, and pamphlets, and so on. So the graduates eventually have competencies in, as I said, you are graduates in public health as well as health communication, which gives you actually an added benefit because your job options can be more diverse. You can work as public health or as health communication, or both actually, depending on the work site. So I hope I answered the question, Amal.
Thank you, Mayada. So Rachel is asking, she's currently pursuing a master's in microbiology and whether she can do a master's in environmental health. So I don't know, Rachel, if you completed your master's or you're currently doing it and where you are doing it. There is the option of transferring from one major to another, whether you are at AUB or at another university, you can transfer to the master's in environmental health. It depends on, of course, your grades in the university, because there is a minimum average required.
Right.
I wouldn't go into, and it's up to you whether you want to do a second master's degree. So this is something that you need to really discuss and think about it. Okay, if we have no other questions, I think we are ready to close the session. Okay.
Thank you very much, Ms.
That's it.
Assis. Thank you for all who attended.
Yeah, thank you, everyone.
Thank you,
Good
everyone.
luck.
Bye.
Don't forget.
Good luck to all. Yes.
20 is the
Thank you.
deadline.
Thank you.
We're looking forward to seeing you among us.
So December 20
Inshallah.
is the deadline, and next week, December 15, is the webinar given by the admissions office. Thank you all for
Okay.
joining, and have a good evening.